Good morning, ladies and gentlemen, and thank you for attending my presentation about peripheral artery disease in senior people. First of all, time changed everything. Nothing really can resist its influence, and nature is the best example of this power. Human body, as a part of nature, goes through natural physiological changes with time. As a person advances with age, every body system such as cardiovascular system, pulmonary, nervous, metabolic, reproductive, musculoskeletal systems go through natural physiological changes. Unfortunately, with age advancement, due to multiple factors, people tend to develop chronic medical problems that can significantly affect different body systems and have influence on lifestyle. And one of the such diseases is peripheral artery disease, or PAD, that affects between 12 and 20% of US citizens that are more than 60 years old. PAD can develop in any blood vessel, but it is more common in lower extremities. Males and females are equally prone to this disease. However, black race is associated with increased risk for PAD. So, what is PAD? Peripheral artery disease is a disease in which plaque build up in arteries that carry blood, usually to lower limbs. Plaque is made up of fat, cholesterol, calcium, and fibrous tissue. When plaque builds up in a body's arteries, the condition is called atherosclerosis. Over time, this plaque can harden and narrow the artery. This limits blood flow to the different parts of the body. PAD usually affects the arteries in the legs, but it also can affect the arteries that carry blood from heart to head, arms, kidney, and stomach. But on this presentation, we will talk about PAD that affects blood flow to the legs. So, what are the symptoms of PAD? The symptoms of blocked blood flow to legs can be pain and numbness. It also can raise a risk of getting an infection in the affected limb. So, if you have a leg pain when you walk or climb stairs, you have to tell your doctor. Sometimes older people think that leg pain is just a symptom of aging. However, the cause of this pain could be PAD. What happens if you will not pay attention to this problem? This problem can go into the severe condition and when the artery blocked completely. And the blocked blood flow can cause a gangrene, which is a tissue death. In very serious cases, this can lead to toe or even leg amputation. A few words about statistics on PAD. So, the risk for PAD among African Americans is 2.5 times higher than among whites. Gender prevalence for PAD is 38% for black men and 41% for black women. The screening of 400 ambulatory patients shows that occurrence of PAD in African Americans is higher than a sum of whites and Hispanic people together. This is a small table that can show this information. So, peripheral artery disease in African American is higher than white and Hispanic people combined together. Studies show that PAD is more prevalent in blacks with diabetes than in whites with the same problem. It is estimated that 1 in every 4 African Americans between the ages of 65 and 74 with diabetes has also PAD. What are the risk factors for PAD? First of all, modifiable risk factors that we can change is atherosclerosis treatment. This treatment is paramount in order to control disease development and diminish ischemic changes. Smoking is the second risk factor that plays huge role, leading role in PAD development. People that smoke or have a history of smoking are up to 4 times higher risk of PAD than those who don't smoke. Hypertension. Hypertension raises the risk of developing plaque in the arteries. Excess blood cholesterol. Excess blood cholesterol contributes to the formation of plaque in the arteries, reducing or blocking blood flow to heart, brain, and limbs. Among African American men and women, nearly 1 in 5 have increased LDL level that 160 mg per deciliter or higher. What are risk factors that we cannot change? Risk factors that are non-modifiable. Gender is the most important risk factor. Females are more prone to develop PAD than males. Age takes the second place when risk factor increases with years, and race. As I said before, African Americans are at highest risk. Type 2 diabetes. Diabetes plays a role in development of many different diseases, including PAD. So in PAD, diabetes type 2 plays a significant role, as well as a vascular disease, myocardial infarction, or stroke. If you have a heart disease, your chance to have a PAD is tripled. So what can we do to prevent PAD? In this situation, smoking plays a critical role in atherosclerosis development. Smoking cessation in a patient with PAD is a vital goal. The second important is a control of hypertension, dyslipidemia, and diabetes. And last but not the least, the regular walking program can prevent PAD. But what can we do if the person already has PAD? In this situation, doctor may prescribe you a special medication for PAD. First of this medication is a cholesterol-lowering medication. This medication is called statin. The goal for people who have PAD is to reduce low-density lipoprotein cholesterol, or known as a bad cholesterol, to less than 100 mg per deciliter. The goal will be even lower if you have additional risk factors like heart disease or stroke, and especially if you have a diabetes or you continue smoking. High blood pressure medication. The goal is to reduce your systolic blood pressure to 140 millimeters of mercury, and your diastolic should not be higher than 90. But if you have diabetes, your blood pressure target is below 130/80 millimeters of mercury. So if you have diabetes, your blood pressure should not be higher than 130/80. If you have diabetes, you have to pay special attention to your blood sugar medication, because it is even more important to control your blood sugar level. One more medication that can be given is a medication that prevents blood clots. A blood clot can completely block already narrowed artery and cause a tissue death. For this reason, the doctor may prescribe you aspirin daily or another medication that prevents blood clots such as clopidogrel, known as Plavix. And the last, but not the least, is a symptom relief medication. For this purpose, the drug called cilostazol is used. It's used to increase blood flow to the limbs, both by preventing blood clots and by widening the blood vessels. It specifically helps treat symptoms of claudication, which is pain with walking, for people who have peripheral artery disease. The alternative for cilostazol is pentoxifylline, known as Trental. However, it's considered to be less effective. What we can do if the situation already is getting worse and the artery is almost or completely blocked? In this situation, we have to do a surgery known as angioplasty. In this procedure, a small hollow tube is threaded through the blood vessel into affected artery, and there, a small balloon on the tip of the catheter is inflated to reopen the artery and flatten the blockage. Doctor may also insert a mesh framework that is called a stent in the artery to help keep it open. In fact, this is the same procedure that is used for heart problems like heart attack and myocardial infarction. The other surgery is used for PAD is bypass surgery. Your doctor may create a graft bypass using a vessel from another part of the body or blood vessel that is made of synthetic fabric. This procedure allows a blood to flow around, or in the other word, to bypass the blocked or narrowed artery. And of course, you all know that the best treatment for any disease is the prevention. That's why I want to stress again about the importance of regular walking programs. Regular walking program can increase the length of time that you are able to walk before you need to have a rest. The regular walking program can reduce your pain and improve the muscle tone. Walking exercise can lose the weight or maintain your weight, especially when you combine walking exercise with dietary changes. Walking program can reduce a risk factor for heart attack or stroke, and which is also very important, can improve your quality of life. This ends my presentation on peripheral artery disease for elderly people. Thank you again for watching me, and I wish you all the best. Bye bye.